Thank you for joining us today for this briefing to update you on CDC's COVID-19 response. We're joined by Dr. Nancy Messonnier, Director of CDC's National Center for Immunization and Respiratory Diseases, who will give opening remarks before taking questions. I will turn it over to you, Dr. Messonnier.
Thank you to all of CDC's partners for joining us today. I want to start by explaining a change in how we will be reporting our confirmed cases of COVID-19 beginning today and going forward. Specifically, we are breaking our case counts into two separate tables. One only tracks people who were repatriated by the State Department, and the second tracks all other cases picked up through the U.S. Public Health Network. CDC will continue to update these numbers every Monday, Wednesday, and Friday. We're keeping track of cases resulting from repatriation efforts separately because we don't believe those numbers accurately represent the picture of what's happening in the community for the United States at this time. So as of this morning, when you break things up this way, we have 13 U.S. confirmed cases and 21 infected people who were repatriated. The 21 number includes 18 passengers from the Diamond Princess and 3 from the Wuhan repatriation flights. I want to update you on the status of the repatriation efforts. As of yesterday, February 20th, nearly all of those who were returned from Wuhan, China, via State Department chartered flights have completed their 14-day quarantine at 4 Department of Defense installations across the U.S. We are truly thankful to those released from quarantine for their cooperation and patience and wish them well as they return home. As well, I'd like to thank the men and women on all of the DoD bases and their families. Also would like to thank the Travis Air Force Base and Joint Base San Antonio Lackland that have continued to open their doors to the recently returned passengers from the Diamond Princess cruise ships. In terms of the Diamond Princess, earlier this week, 329 U.S. citizens returned to the United States aboard 2 State Department chartered flights. So far, 18 have tested positive at CDC. There are an additional 10 travelers who tested positive in Japan. Multiple of these patients are receiving care at hospitals around the bases. Because the passengers on the Diamond Princess were in close setting where they had a significant risk of spread of COVID-19, they are considered at high risk for infection, and we do expect to see additional cases among the passengers. Also, since many of these passengers are over the age of 60, we're prepared for other medical issues to arise that will require hospitalization. We're going to do everything we can to make their quarantine as easy as possible while monitoring them to see if they develop illness. Our goal for those people who have been repatriated is to be sure that each person is properly cared for and that those who need medical care receive it. To ensure this, we're working closely with local hospitals as well as other facilities around the country who are prepared to provide this care. Now, despite our increased cases in China and around the world, we believe our aggressive travel precautions are working. As I said, the number of cases detected through regular U.S. surveillance system has, as of this morning, increased by 1 to 13. The most recent patient was announced last night by California. The fact that we have been able to keep this number low is good news, especially given what we're seeing among some countries in Asia that are beginning to experience community spread. This is when cases are detected in the community, but it's not known what the source of the infection was. This is being reported from Singapore, South Korea, Taiwan, Thailand, and Vietnam, as well as Hong Kong and Japan. The last 2 countries were issued level 1 travel notices for earlier this week. We're working in close coordination with the State Department to keep travelers informed with the up-to-the-minute guidance, including cruise ship travel. And I would just let you know that as of late yesterday, the State Department did post some new guidance about cruise ship travel for Americans. That guidance is also posted now on CDC's travel website. We never expected that we would catch every single traveler with novel coronavirus returning from China. Given the nature of this virus and how it's spreading, that would just be impossible. But we're not seeing community spread here in the United States. It is possible, though, that it will happen in some point in the future. Our goal continues to be slowing the introduction of the virus into the U.S. This buys us more time to prepare our communities for more cases and possibly community spread. The new virus represents a tremendous public health threat. We don't yet have a vaccine for this novel virus, nor do we have a medication to treat it specifically. We are now taking and will continue to take unprecedented aggressive action to reduce the impact this virus will have on communities in the United States. We are working with state, local, and territorial health departments to ready our public health workforce to respond to local cases and the possibility this outbreak could become a pandemic. We're working closely with healthcare systems across the country to reinforce infection control principles and plan for surges of people seeking care and requiring care. We're collaborating with supply chain partners to understand what medical supplies are needed and available. This will help CDC understand when we may need to take more aggressive measures to ensure that healthcare workers on the front lines have access to the supplies they need. We're working with businesses, hospitals, pharmacies, clinicians, manufacturers, and distributors to communicate about these measures and what they can do to get ready. I want to direct everyone to information on CDC's website that provides guidance around community mitigation. The guidance that we're pointing to right now is an MMWR on community mitigation guidelines to prevent pandemic influenza in the United States, 2017. But we're reviewing all of our pandemic preparedness materials and updating them to reflect novel coronavirus. These materials will serve as a blueprint for the community interventions that we will use here in the United States. If you're watching the news, you'll be hearing about schools shutting down and businesses closing in countries in Asia to reduce the potential spread of the virus. The day may come when we will need to implement such measures in the U.S. By next week, we expect to be posting a new webpage focused on what the CDC is already doing to mitigate transmission in communities. We recognize the uncertainty of the current situation. As always, CDC public health experts strive to make the best recommendations based on the most up-to-date data. Our guidance will change as we learn more about this virus. When that happens, we will share it to you. I'd be happy to take some questions.
Thank you, Dr. Messonnier. We are taking questions now from questions sent in previously. Our first question, what is known about pregnant females and COVID-19's effect on the mother and the child?
So the concern here is whether or not there is intrauterine infection that is caused by transmission from women to unborn babies. There is one recent published article in The Lancet, but in that article, there's no evidence of intrauterine infection. Now, pregnant women experience immunological and physiological changes that might make them more susceptible to respiratory viral infections. In general, pregnant women are also at risk for severe disease, morbidity, and mortality. But right now, we have no evidence that the risk that the virus is spreading among persons in the United States, in the community, and the risk to the general public is low. However, pregnant women should, as always, engage in usual preventive actions to avoid infections, like washing their hands, covering their cough, and avoiding people who are sick.
The next question, is there any timeline as of yet for a peak in disease spread?
That's a really important question. Right now, we don't have a clear answer for how long the outbreak will last in other countries or the U.S., because it's dependent on many things. We are obviously looking closely at the extent and growth of the outbreak throughout China and especially in Wuhan. We're looking at the impact of social distancing and travel restrictions, the extent to which sustained transmission is occurring in other countries. But there are uncertainties about this virus. We have to remember that this virus was only first discovered in the beginning of January, and still we are in the early days of learning. Now, in the United States, there are a number of mathematical modelers that are all working together, as they have for many years, around infectious disease modeling. This group has been convened with CDC for work that we've done in the past on influenza, and we're heavily leaning on them now to look at the same data that we're looking at, but looking at it differently, and to try to make predictions based on that modeling as to how this is going to roll out in the U.S. I think it's really not clear yet that we can be concrete. All we should be saying now is that we do expect additional cases in the United States, and that the window of time that we have bought by border measures that slow the spread down, we need to use that time well to prepare better.
The next question, When do we expect the travel ban to be lifted? I am hearing that Delta is planning to start flights in March.
Yeah, at this point, CDC is continually assessing the situation, and the travel notices are, as you know, a level 3 travel advisory to China, level 1 watch travel advisory for Hong Kong and Japan. That is, travelers to Hong Kong and other countries should practice usual precautions. We are every day looking at the global data on where the disease is spreading to make sure that we are as up to date as possible in our travel notices and working closely with the State Department to coincide with them. I understand that Delta has made some projections, but at this point it is really premature for CDC to make any kind of predictions as to when the travel bans will be lifted. What we need to focus on now is continuing to try to slow down the spread of this disease into the United States.
The next question, a little bit long. Request Dr. Messonnier comment on recent article in Journal of Hospital Infection stating that human coronaviruses such as severe acute respiratory syndrome, SARS coronavirus, Middle East respiratory syndrome, MERS coronavirus, or endemic human coronaviruses can persist on inanimate surfaces like metal, glass, or plastic for up to 9 days, but can be efficiently inactivated by surface disinfection procedures with 62 to 71% ethanol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite within 1 minute. Other biocidal agents such as 0.05 to 0.2% benzalkonium chloride or 0.02% chlorhexidine digluconate are less effective. This hard surface survivability information is quite different from what most medical advisors have been saying, that virus survives for only a matter of hours off host.
So the article that this is referring to provides a review of 22 separate studies that looked at survivability of SARS, MERS, or endemic human coronaviruses on a variety of surfaces. There are 22 studies, and yet each of those studies only looks at a few different data points, not broadly across, for example, all the strains or all the possibilities. So what I would say based on that is, even in that data, the virus doesn't seem to survive long on paper. And so one question related to this data is a question of whether packages coming from China are at risk, and we continue to believe that that's a low risk. A separate question is, does the survivability on surfaces tell us anything about transmission of the virus? What I would say about that is what those experiments look at is truly whether it is existing on surfaces or not. What it doesn't tell you is whether the virus that's on those surfaces is a risk to the humans in the environment. We obviously want to know that question for SARS and MERS, but we specifically want to know it for this novel coronavirus. And there are studies ongoing to look at the survivability in the same kind of experiments that are talked about here for the new coronavirus. But equally, we are looking every day at the global data to try to determine if it tells us anything about transmission patterns. At this point, based on what we know about this novel coronavirus, but also what we know about MERS, SARS, and the endemic human coronavirus, the data still says that the majority of transmission is occurring through respiratory transmission, but as more data is available, clearly we'll be updating you on that.
Next question. We have had employees asking if it is safe to travel within the United States via air travel with the coronavirus status. While the coronavirus is not here in the U.S. in large proportions yet, is it safe to air travel? What precautions should an air traveler take right now?
Thanks for this question. I think it's an important one. Right now, we think that there is no reason for people to change their travel plans unless they are traveling to China, which again, we have a level 3 travel notice, or to Hong Kong and Japan, where they should be aware and looking at practicing usual precautions. And as I said, there are new recommendations from the State Department mirrored by CDC about travel on cruise ships. But for air travel at this point, we don't recommend anybody else change their plans. In terms of precautionary measures, the things that we would recommend are the things that we always ask as best practice for people to do, especially when they're traveling. You should avoid close contact with people who are sick. You should avoid touching your eyes, nose, and mouth with unwashed hands, and you should wash your hands frequently. Those are the kind of things that you should always be doing to prevent the risk of getting infectious diseases while traveling.
Next question. It would be interesting to understand the general audience to the private sector around the following scenarios. If there is a suspected or confirmed case in the office, on the share floor of a corporate office, within the building of a corporate office considering community utilities, elevators, thoroughfares, and HVAC, within a staff member's residential building, assuming they live in an apartment.
Yeah, thanks. So we'll start by saying that right now in the United States is no evidence of community transmission, but in this window of time that we have by slowing the spread of the virus, this is the time when we're really asking all of our partners, including private sector business partners, to look at their own policies and guidances for infectious diseases so that if we do have community spread in the United States, they're ready. You don't want to be trying to figure out these specific issues when your first case occurs. You want to know ahead of time what you would be doing. So far, for this virus, it's thought to spread mainly person to person, as I said, from respiratory routes with people who are in close contact via respiratory droplets when an infected person coughs or sneezes. So surfaces are not thought to be the main mode of transmission. But if you have a patient who is ill, we would suggest that you actively encourage sick employees to stay at home and specifically look at your sick leave policies to make sure that they're flexible and consistent with public health guidance. You want to be able to separate sick employees, that is those with cough or shortness of breath, and emphasizing the importance of respiratory etiquette and hand hygiene for all employees. And of course, you should be performing routine environmental cleaning. As you heard from the previous question, we know a bit about what kind of cleaning is effective on surfaces for viruses like this, and those are basic routine cleaning of touch surfaces. Those are the kind of policies and procedures that we would really suggest all businesses pull out and make sure are up to date in preparation for the potential for cases more broadly in the United States.
Thank you. Next question. Do community-acquired bacterial co-infections, e.g. secondary bacterial infections, contribute to morbidity/mortality of COVID-19 patients?
So I think the premise for this question is that we know from influenza that bacterial co-infections of patients with influenza can actually be really serious and more serious, and cause some of the morbidity and mortality associated with influenza. And so, of course, the question is, are we seeing the same thing with COVID-19? In the United States right now, we haven't seen any such co-infection. I think it would be a mistake to talk more globally about data that we haven't seen yet. I think it is certainly a possibility, but there's no direct evidence yet as this is a major risk factor.
Next question. Do hospital-acquired bacterial infections contribute to morbidity, mortality of COVID-19 patients?
Yeah, so I don't know that, again, as back to the previous question, I don't know that there's any specific substantive data about bacterial co-infections, either hospital-acquired or non-hospital-acquired, associated with COVID. There have been some unpublished reports of hospital-acquired bacterial infections in critically ill COVID-19 patients, but that is still not validated literature. And I think these are important hypotheses, and in the United States, very important for us to maintain impeccable infection control on any U.S. patients, and certainly prevention of hospital-acquired infections is a priority for our day-to-day care, and certainly would be a priority for COVID-19 patients.
Next question. How has the criteria for counting cases changed in China? It changed last week, and we saw the increase in the daily increase, and now it has changed back again to the prior way of counting the cases.
Yeah, There have been several changes in the way that China has reported their cases. Specifically, there was a change where they included clinical confirmation without laboratory confirmation, and that met the criteria for a case. Later this week, that criteria seemed to go back. It does make it a little difficult to look at the trajectory of cases in China, and at CDC, we're carefully evaluating that data to make sure that we understand if cases are rising at the same rate that they had been previously.
Next question. My colleague heard that CDC was holding a lot of country calls. Is there different locally relevant messages in these calls?
Yeah, I'm actually not sure I understand this question, but we hold regular calls with a variety of partners inside the United States and outside the United States. And outside the United States, we're holding calls with multiple countries and with multiple of the CDC staff that are embedded in countries. As you know, CDC staff have worked for many years in a variety of countries around the globe on a variety of issues, including global health security preparedness for those countries for exactly those kind of events. And the kind of situational awareness and preparedness information that we're providing to you is the same discussion that we're having with our CDC staff in countries, as well as with the Ministries of Health and World Health Organization entities in country, as around the world and globally, everyone tries to institute measures to enhance surveillance, control this disease, and prepare for potential additional cases.
Next question. Should companies communicate about the virus and its spread? What do you recommend organizations focus on? Should companies be reviewing their sick leave policies?
So as I said before, it's really important in this interval of time that we have given ourselves that we spend the time well, and I would definitely encourage companies to always communicate with their employees and to look at the CDC's website where we have specific guidance for the private sector and use this opportunity to make sure that their company guidance is up to date.
Next question. Have you suspended business travel to, from the affected region? Some companies are requiring employees to work from home for a period. Is this advisable?
As I said before, we have specific CDC guidance on our travel restrictions, and those are up on our website, and they haven't changed. And I would definitely refer you to the CDC. I would refer you to the CDC website, where we are very thorough in assessing the risk, and also the State Department website, where they similarly have guidance on travel and where we think Americans, including business people, what considerations they should give for their travel.
Thank you, Dr. Messonnier, and thank you to all of our partners for calling in today. Please check CDC's 2019 COVID-19 website for the latest updates on CDC's response efforts. If you have further questions, please email eocevent337@cdc.gov. Thank you.